My name is Sam Parry. I serve as an associate editor for the Gray Journal, and I am the director of maternal fetal medicine at the University of Pennsylvania. Today, we will review a report from Carolyn Mars and her colleagues at the University of Texas Health Science Center at Houston. The title of the article is "The Relationship Between Primary Cesarean Delivery Skin Incision Type and Wound Complications in Women with Morbid Obesity." In this study, Dr. Mars and her co-investigators performed a secondary analysis of a multi-center observational cohort to determine whether a vertical or transverse skin incision was associated with a lower wound complication rate in morbidly obese women undergoing primary cesarean delivery. This study is timely because of the increasing prevalence of obesity in the obstetrical population, the increased incidence of cesarean delivery, and the increased rates of post-operative complications in obese women following cesarean delivery. As the authors of this study explain, skin incision for cesarean delivery in morbidly obese women currently is based largely on surgeon or institutional preference. With a transverse skin incision, there is concern for poor wound healing due to the incision being covered by the pannus and greater exposure to microbial flora and low oxygen tension. On the other hand, a vertical skin incision could theoretically heal poorly due to a longer incision, a deeper subcutaneous layer, and more wound tension. No randomized clinical trials comparing the risks and benefits of skin incision type for cesarean delivery in obese women have been published. So Dr. Mars and her colleagues utilized a multi-center cesarean registry to compare rates of wound complications and other maternal complications in women with a body mass index greater than 40 kilograms per meter squared who underwent primary cesarean delivery following transverse or vertical skin incision. The investigators utilized retrospective data from the cesarean registry of the Eunice Kennedy Shriver National Institute of Child Health and Human Development Maternal Fetal Medicine Research Obstetrics Units Network, conducted from 1999 through 2002 at 19 academic medical centers. Their analysis focused on women whose BMI at delivery was greater than 40 and who underwent primary cesarean delivery at greater than 24 weeks gestation. The primary outcome was a composite of wound complications, including wound infection, seroma, hematoma, wound evisceration, and fascial dehiscence. The secondary outcome was a composite of other maternal complications, including blood transfusion, hysterectomy, organ injury, coagulopathy, thromboembolic event, pulmonary edema, and death. Demographics and outcomes were compared between study groups, and multivariable analyses were performed using logistic regression for the development of wound complications, maternal adverse composite outcome, and vertical skin incision. The results of the study were as follows. 2,603 women who underwent transverse skin incision were compared to 597 women who underwent vertical skin incision preceding primary cesarean delivery. Women who received a vertical skin incision were more likely to be Black or Hispanic, have pregestational diabetes, and have a slightly greater BMI. Maternal BMI in the transverse skin incision group averaged 45.3, while maternal BMI in the vertical skin incision group averaged 47.2. Rates of chorioamnionitis, use of prophylactic antibiotics, and emergency cesarean delivery were significantly greater in the vertical skin incision group. Approximately 75% of women in both groups were in labor before cesarean delivery was performed. The composite wound complication rate was 2.1%, and most of these complications were infections or seromas. In univariate analysis, the composite wound complication rate was 4.1% in the vertical skin incision group compared to 1.7% in the transverse skin incision group. The p-value was less than 0.001. The composite adverse maternal outcome rate was 5% in the vertical skin incision group, compared to 2.9% in the transverse skin incision group. The p-value was 0.02. The most common adverse maternal outcome was endometritis. In order to correct for potential confounders and other selection biases in the vertical skin incision group, logistic regression analysis was performed. After correcting for other factors that were associated with wound complications, including greater BMI and Black or Hispanic race, vertical skin incision was found to be associated with a lower rate of wound complications compared to transverse skin incision. The adjusted odds ratio was 0.32 with a 95% confidence interval of 0.17 to 0.62. A separate logistic regression analysis was performed that indicated that vertical skin incision also was not associated with the development of the composite adverse maternal outcome. This study is a good example of the need for logistic regression analysis when performing observational studies. Patients were not randomized to vertical or skin incision, and it is likely that patients with vertical skin incisions had other factors that placed them at risk for wound complications. In fact, women in the vertical skin incision group had greater BMIs and were more likely to be Black or Hispanic, have diabetes, and have chorioamnionitis during labor. After correcting for these confounding variables, vertical skin incision was found to be associated with a lower rate of wound complications than transverse skin incision in morbidly obese women. Two obvious strengths of this study are the large patient population and the multi-center design, which yield more generalizable results. Previous studies also were not randomized and had much smaller sample sizes. Limitations of the current study include the absence of postpartum outpatient records, which probably accounts for the overall low rate of wound complications reported in this study compared to previous observational studies of morbidly obese women who underwent cesarean delivery. In addition, different types of vertical or transverse skin incisions above or below the mother's pannus were not considered. Overall, this study is important because it's the largest observational study performed comparing vertical versus transverse skin incision for cesarean delivery in morbidly obese women. The investigators' findings suggest that vertical skin incision may lead to fewer wound complications than transverse skin incision in these women. For now, obstetricians probably should continue to perform transverse or vertical skin incisions based on personal or institutional preferences when performing cesarean delivery in morbidly obese patients. However, randomized controlled trials are needed to determine the optimal skin incision. Because of the frequency of cesarean delivery and the urgent need for optimal care guidelines in obese women, such trials are a high priority area for clinical investigators.